Good evening. I want to thank everybody for coming out and watching the show tonight. If you are not watching, you can always watch later. It is on Facebook Live, it's on YouTube also. But we have some guests with us tonight. I'm so happy again to have Jack and Jill. But we had the men last time, and now we have the ladies this time. And I'm going to let them introduce themselves. And we have Mr. Luke here with us tonight with the Red Cross, and we have Kia with Jack and Jill Western Maryland chapter. We have Aria and Aaliyah. So I'm gonna let Mr. Luke introduce himself first, and then we're gonna jump in. And I don't know how I'm gonna do this because I usually don't have this many people on my show at one time, but we're gonna see how we can make this work because. You know what? I'll do ladies first. We'll do ladies first.
Yeah, that works.
Aria, how about you tell me about yourself? What grade you're in? What school you go to? What's your favorite and your favorite hobby? Tell me about that.
I'm in 6th grade. I go to St. John's Regional Catholic School, and my favorite hobby is probably drawing and doing gymnastics.
Okay, where do you go to gymnastics?
Frederick Gymnastics Club.
Oh, that's a good one. How long you been doing gymnastics for?
For about like 8 years, I think.
Okay, and you're in 6th grade, so that is middle school, yes?
Mm-hmm.
Okay. And Aaliyah, go ahead and introduce yourself.
My name is Aaliyah. I'm in 7th grade, and I go to Urbana Middle School.
Okay.
And my favorite hobby is probably either dancing, or sports.
Are you in dance right now?
Yes. So I do Palms in the fall, and right now I'm taking dance classes to help me with that.
Where do you take dance class at?
Urbana Dance.
Urbana Dance. And you said, what's the other one that you said you do?
Sports.
Sports. What sports do you play?
I do basketball and volleyball.
Are you good?
Yes, I would say so.
How long you been playing basketball and volleyball?
Basketball I've been doing for a while, and volleyball I just started last year.
How tall are you, Aaliyah?
I'm 5'5".
Okay. And Kia, go ahead and introduce yourself.
Hello, everybody. I'm Kia Tisdale, and I'm the co-chair of the Trailblazers, of which Aria and Aaliyah are two of our esteemed Jills. And I am just pleased as punch to be here with you again. And I'm just grinning from ear to ear because I have these two lovely girls here, and I'm excited to hear what they're going to share with us. And I'm just thankful that you are having us back on your platform to talk about the importance of blood donation, especially Black blood donors. So thank you again, Ms. Terrellin.
Thank
you. And
you
want to know my hobbies? You want to know my hobbies?
Yeah. You know what? What's your hobbies?
Let's see. So my hobbies are, I love live music, listening to live music. And I also enjoy reading and watching my children. I have a son who plays basketball, so I enjoy watching him play basketball. And I have a daughter who enjoys volleyball and dance. And then I have a young one who likes playing outside. So those are my hobbies, I guess.
You have a lot of hobbies, Kia. How do you do all these things?
Yeah. No,
and
works.
Luke, last but not least, Luke, go ahead and introduce yourself.
All right. Good evening, folks. My name is Luke Anderson, and I'm what we call I'm with the American Red Cross and account manager, but more specialized in sickle cell anemia. And I reside in the Howard County area of Maryland. And I call my geographic area that I'm responsible for is what they call the Greater Chesapeake Potomac region, which in other terms, most people relate to DMV, the Virginia, Baltimore, Washington, Washington, Virginia area, if you will. So that's my coverage. And key responsibility is looking to, not only increase blood donations, but specifically hone in on people of African American descent or Black folks, and in trying to not eradicate, but create a better quality of life for patients, or what we call sickle cell warriors, who need blood and particularly matching blood. When I say matching blood, I'm referring to blood that particularly comes from African American or people of African American descent, which makes a difference. And so that creates that better quality of life if you have that, and that's the constant goal and objective, which is it's a challenge, but I think we're going to be in better shape in time to come here.
Okay, so you got to follow the trend, Mr. Luke. So when you're not working for Red Cross and educating me about sickle cell, what's your hobby?
Well, the thing that I enjoy most that I burn steam off in this therapy is I play tennis.
Tennis?
Yeah, I play
tennis. Are you good?
Yeah, I'm pretty good. I actually, well, this way, I'm somewhere in between. How about that?
Okay. So Serena and them, they probably would just
no. Yeah, I enjoy watching them, but I don't have that kind of skill. So,
I thank you for being on my show.
Absolutely.
And everybody that's watching, for us to get more people registered, we need to share this video, okay? We need to make sure that we share and get people out there, because it's really important that we get our people to donate, especially African American, the community, African Americans in our community, to donate blood. And so we're going to go into our discussion, because this is a really important topic. And so you were saying, Mr. Luke, that you like to, or you educate or more focus on African American descent. 1 out of 500 African Americans, and that's about 1 in 12 African Americans, carry the autosomal recessive mutation. I'm not a doctor. Oh gosh. And approximately 300,000 infants are both with sickle cell anemia annually. Okay, so how early can sickle cell anemia be detected? How early is that going to be detected?
Yeah, it can. Can I do this? At least give the folks a quick background, if you will, on what sickle cell disease is. Is that okay?
I was going to Mr. Luke.
Forgive me. I apologize.
I will definitely give you the opportunity to talk about that.
My apologies.
But if you want to reverse my questions, you're more than welcome. What is sickle cell caused by? And go ahead and give me the background.
Yeah, it's just at least it gives you some sense of things. And no,
I'm gonna bring you back as a co-host. How about that?
No, yeah, forgive me. Again, I said this is all new to me. I'm gonna start listening for all directions. So basically, what is sickle cell disease? That's to use it a bit. I call the front end question. And so sickle cell disease affects the red blood cells. I think we most know that, but it makes it, the cell hard and sickle shape instead of the soft and round. And of course, it'd be nice to show a visual of it, but you have to kind of, paint the picture, at least in your mind, the sickle component, the smooth blood cells, which allows it to flow freely through the arteries and the veins and the vessels, if you will. As a result of the disease, blood has difficulty flowing smoothly and carrying oxygen to the rest of the body. So sickle cell disease is the most common genetic blood disease in the country. So that's sort of in a brief fashion, if you will.
Okay. And so would you like to answer my next question?
Okay, sure. I will, promise.
Go right ahead. Tell me, how early can sickle cell be detected? And
that's a good question. I know that early on that wasn't, at least during, say, my period when I was coming up as a child in the physicals and things in that nature, it was not part of the exams, if you will, the blood testing, etc. So that can be done early on. I maybe Dr. Tisdale could speak to this in respect to a what point that became a regular event, if you will, when that was first, I guess, incorporated, first done, such that this would be a part of the, the early stages of children having exams and things of that nature. But that can be detected pretty early on, and that's being, by blood test. I mean, it's almost like even now when you're preparing yourself to not only donate blood, but obviously figure out where you are in the process, whether it be whether you have it or not, or whether you carry the proper blood or the blood that we're matching, even down to some of the things that at least previously we talked about, as far as the deficiencies they may come along with providing blood to the right person. So maybe Dr. Tisdale could specifically note that, if you will, because I know what was before and what's happening now, we're far beyond detecting that than what we once were.
Yeah, Dr. Tisdale, when a parent is a sickle cell anemia carrier, they have sickle cell anemia. Is that something that you test the baby when she's pregnant? Is that something you test the baby for while she's pregnant, or is it? Or she has to do that?
So unfortunately, I'm not an obstetrician, so I cannot tell you, and a current obstetrician may not be able to answer this either. I can't tell you the year that they started being able to screen and detect if this baby is going to have sickle cell anemia, but certainly it's been for many, 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 many years, because like you said just a few moments ago, we do know that it is an autosomal recessively inherited. And so just as we can detect when people donate blood, you can determine if they carry the trait, you can easily determine when someone has actually sickle cell anemia, which means they have both alleles for the disease versus just having one of the alleles and just being a carrier. And so I think maybe one of the questions that you might have been asking too is, when we say detected symptoms, and so like Mr. Anderson was saying, because those red cells in someone who is impacted by sickle cell anemia, their red cells are oddly or sickle shaped, they become hard. And so they no longer move as freely through the body and through the organs. They have these crises. And so that detection almost is, that sickling / detection is what is the hallmark of sickle cell anemia, or what becomes the hallmark of sickle cell anemia. And that is the difficulty that these patients have in providing adequate blood and oxygen to all of their vital organs, their brain, their liver, their heart. But definitely, we've been detecting and testing for sickle cell anemia for many, 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 many years.
Okay, thank you for that. So you had mentioned the sickle cell crises. Mr. Luke, could you tell me about the different types of sickle cell crises, or Dr. Tisdale, of like what that looks like?
With respect to the pain aspect of it, and the
Yeah, the
crisis,
sickle
where
cell
the pain,
crises. Yes.
the pain management, or the thing that, going back to what she was saying about the sickle cell, the sickle, if you will, and that pointing, it tends to clog the blood flow, if you will, and and I basically say the spiking, if you will, within that blood channel, or the veins of that sort, that creates the pain, if you will, which creates that that pain crisis. And so, and Dr. Tisdale, you can fill in the blanks here, but we have the right blood component, if you will, or in this case, whether it be the antigens and the matching component that we have with folks who are of African descent, that sort of facilitating the need. And then there's the pain management, and then there's the pain medications that take to help to relieve that crisis, if you will. Those are two. I'm not going to say modalities, but you have one, the blood aspect of it, and then you have the pain medications. And I'm not even sure how many. Dr. Tisdale, is it a half dozen medications presently for this pain management for a sickle cell patient?
So I will talk about how crises can be devastating to someone with sickle cell anemia. So if you think about how important oxygen is to the human body, and a lack of oxygen or blood, but notably oxygen to any organ, what would happen? That organ is going to die. And so a lack of oxygen and blood flow, because blood carries oxygen, that lack to the brain will cause a stroke. That a lack of oxygen and blood to the heart attack. That lack to kidneys, kidney failure. So you just think of the organ and what that organ does for you, and the loss of that organ. So So yes, the pain, because muscles, so if you have a lack of blood flow and blood that carries oxygen to your muscles, then you can't, when we exercise, we have increased blood flow to our muscles. So in someone with sickle cell anemia, that would be extremely painful, because if that sickled blood cannot carry adequate oxygen, that is going to be a cause of extreme pain. If that sickled blood is not carrying oxygen to the brain, that's cause for a stroke. And so that is, I would say, the easiest way to think of how catastrophic sickle cell anemia can be to someone is think of the organ, what that organ does for you, and what would happen if part of that organ dies. Stroke, heart attack, kidney failure, muscle failure. And so like what Mr. Anderson is saying, when we talk about he started talking about pain crises. Yes, pain crises, I think, get a lot of attention because that's often one of the air quotes easier things that we can do for someone with sickle cell anemia, because the matched blood is something that is so critically needed and in such short supply. So we manage people by giving them pain medication. We manage them by giving them lots of volume to kind of help unclog that thickened sickled blood. So IV fluids, pain medication, and there are, I think hydroxyurea, lots of things. I haven't treated a sickle cell a patient with sickle cell anemia since residency. But yeah, the pain crises get a lot of attention because, often that's kind of the mainstay of the treatment. But what is really life-saving is giving them those blood products.
Okay.
So replacing abnormal blood with normal blood.
Okay. Now tell me, Mr. Anderson, why are African Americans affected more by sickle cell anemia than other races? And
it's I will say it's about probably around the 90% mark that the folks who are have sickle cell are Black or African Americans. I do know that they looked at, for example, I think it was the data. I'm looking at some of the things that you mentioned before about the actual data. If you want, that 1 in every 13 Black African Americans carry the trait. We talked about that earlier. 1 in every 365 Blacks or African American babies are born with the disease. And of course, that's the detection. And then there's a small E, and you said 90%. You talk about the smaller component of ethnicity. There's about 16,000 Latin babies who are born with sickle cell disease also. But that's about 1 in every 16,000 versus a shorter component of the 1 in every 365 Blacks. So in the U.S., sickle cell disease affects about, if we go back again, about 100,000 people, approximately 100,000 by people of various races and ethnicities, but most who are African American or Latino descent. So that's, again, statistically, I know that's the particular reason why the American Red Cross is taking on this as an initiative, because it's very important, even though it's I like to say that people say, well, they're comparing disease states to disease states and hypertension and diabetes because of the large, effect of those patients. But this is very specific to a patient type. And I feel like I'm rambling here, but I want to say this, and this may be a question, and I'm going ahead of myself here. But again, we talk about that matching blood being important from African Americans or Blacks, if you will, to one who is a sickle cell warrior or a patient. But then you think about a large percentage, somewhere between 47% and 50% of African Americans have O type blood. So it's not only the matching component, but it's also universal in many ways in respect to trauma, cancer, et cetera. So it's dual benefits from that perspective. So giving is very important.
Okay, so I think Aria,
people of various
now
races.
that we're talking about matching blood, why is ethnically matched blood so important?
So people with sickle cell anemia who receive lots of blood transfusions create antibodies to donor blood every time they get a transfusion. These antibodies can cause transfusion reactions that can sometimes be dangerous to the patient with sickle cell anemia. Ethically, matched blood limits the amount of transfusion reactions because the blood is so much more compatible to the person who receives the blood.
I'm sorry, was it a question?
Was it to Aria? Yep. I'm talking Aria. Aria answered my question. Thank you, Aria, for that.
Okay,
and Aaliyah. So so ethically matched blood is important, is more than just an AOB type matching. Yes?
Yes. AOB is just one part of donor compatibility, and there are different proteins that are in our red blood cells.
Okay. And so I know that this blood drive is so important, and educating the community is so important about blood drives. Mr. Anderson, shortly, just briefly, just tell us how Red Cross educates the community, what you guys do in the community to educate them, so that you can pull people in to go to the blood drive.
Yep. Well, it is. I know from my responsibility, it's only actually 17 of us in the country as far as sickle cell account managers, but we have a pretty good, I would call, a group of account managers who we work in conjunction with, and part of the responsibility is going into for me, particularly going into the Black community, seeking those organizations. Those companies, if you will. I've had experiences with large, what they call the Divine Nine sororities, fraternities, tapping into the sources where we are in large groups who are, I call easier to focus on, and then be able to sit down or either do it virtually and talk about the things that we're talking about now. Why is it important? How many folks it affects? What the actual blood and what it means to the matching blood component. So that's part of the education, and then, but more so, getting that message over to a specific group. And in most cases, these are where, particularly in the Baltimore, Washington area, where there's a high concentration of Black folks, and that could be the churches, which has been a heck of an effect in the churches. Even communities that are the NAACP. I've had experiences where we've had the NAACP do various blood drives. And then from that, there's the fraternities and sorority organizations. There's churches that are, that are networked from that having that network source. So touching those places that where we are in concentration, where we are, sort of missing, if you will, lapse, but more importantly, educating those groups. And that helps to expand, the education beyond me and the account managers, more so the folks who are in the community.
Okay.
Who truly need the help.
Okay, thank you for that. So Jack and Jill is one of those organizations that is part of this. And so Ari and Aaliyah, could you tell me, is it true that people with sickle cell anemia can require hundreds of units of blood every year just to live? Tell us about that. Ari and Aaliyah, can you guys tell me about the 100 units of blood a year that we have to use, that people need to live?
How many, or people do require hundreds of units of
I know
blood.
that we need lots of blood, right? Mm-hmm. We need lots of blood to get people to feel better, and their needs. So that means that a lot of people need to donate. And so, why is that important? Why is that important that we need that much blood?
I'll jump in. So the reason that we need so many more people of African descent to donate blood is because people with sickle cell anemia, some of them require hundreds of transfusions a year. because again, they are making abnormal blood cells, and we have to basically swap it out with normal blood cells. And the only way to swap it out with normal blood cells is if we have an adequate supply of donors with ethnically matched blood.
Okay, thank you for that, Dr. Tisdale. Now, Ari and Aaliyah, I know that your friends and your peers are really important, and your family is also important. Do you guys ever have the conversation with your families of why they do and why they don't donate blood, and why the numbers are so very low in African American community when it comes to donating the blood?
I don't know if she wants to go first or if she wants me to go first, but I have talked with my family about why they do or do not donate blood. And my mom has been tested to see if she is eligible to donate blood. And she can't because she's anemic. So she is not able to donate blood. But I'm sure if she could, then she would.
And Aria, have you done the same?
Yes, actually, so the first time my mom donated blood, she actually fainted because she was so nervous, and she still is nervous about donating blood.
Okay, so how do you help people that are nervous about donating blood? How do you educate people when it comes to helping them not to be so nervous about donating blood? Maybe educate them, give them some information, some websites that they can go to, maybe, possibly.
Yeah, just information on
I could tell them how easy the process is about donating blood, all that process.
Okay, and so, ladies, tell me, what are some ideas that you have to increase the numbers of donors in African descent?
To keep hosting blood drives that target donors of African descent. Jack and Jill of the Western Maryland chapter is doing their second blood drive on April 29th from 9 to 2:30 at the Boys and Girls Club on Burke Street to help and for people to donate blood.
Okay, and Ari, what would you do?
I could remind them about the $20 Amazon gift card when they donate blood.
Wait, we get an Amazon gift card. Did you say that? $20? I need that $20. I think I'm gonna sign up because I need that $20. That just get me there right there. What else would you? Why is it also really important that they come out and donate? Give me another one.
It's also important because people need this blood to help them survive. So it would really help if people would donate their blood.
Okay, and what are some reasons why someone would not be able to donate blood?
So when you register, you fill out a questionnaire that determines your eligibility. And on site, you are checked to see if you're anemic before you donate.
Okay, and being anemic is is that the only reason why you won't be able to donate blood? Is that the only reason, Dr. Tisdale?
No, and actually there are not that many reasons that would make someone ineligible to donate, but there is a number and a customer service line that people can call to determine their eligibility or ask questions to determine if they're eligible or not. And that number is on our flyer, which is on the Jack and Jill Western Maryland chapter Facebook page. But again, there are very few reasons that someone would be ineligible to donate. So we wouldn't want you to not register. But that, like I said, that 800 number is on our flyer. So we want people to, if nothing else, register, call that number, but don't let what you may have heard keep you from registering to donate blood.
Okay, and so Mr. Anderson, is this, you guys work with the Jack and Jill Western Maryland? Is this the second time they work with your particular chapter region, or is this the first time?
This will be personally for me my first time having a connection with Jack and Jill.
Okay.
As Dr. Tisdale and some of the ladies have said, this is a second annual. This is taking on, and this is within the Chesapeake Potomac region. So the Western Frederick County or the Jack and Jill fits in that region.
Okay.
And, so I don't know, maybe Dr. Tisdale, this is the second annual. So you had one for the first time last year. Is that correct?
Yes.
Okay. Yeah. All right,
and so Aria, is this something that the Jack and Jill plans to do every year? Because this is the second one. Do they plan to do it every year?
Yes, it is. We, along with our partner, the Boys and Girls Club of Frederick, are dedicated to increasing the number of blood donors of African descent and increasing awareness of why the need is so critical.
And Aaliyah, could you tell us why it's so important to have the community support?
People of African descent should donate blood because there's a need for Black donors is critical. And if you are Black, blood from Black donors reduces the risk of serious transfusion reactions. 90% of people with sickle cell anemia are Black, and less than 3% of all donors are Black. So if you are of African descent, you should donate because we need you to donate blood to save a life.
And Mr. Anderson, could you tell us when it comes to the donation of the blood, how do you guys, how's that process working? You getting it to the patient? What does that process looks like? And how many individuals do you help with the blood drives? Like how many individuals do you normally help?
Yeah, typically when the donor goes from, they'll be at Jack and Jill at your location, they'll go into the health, booth, if you will, and you'll have a nurse or someone who is trained in Q&A, and they will take the blood prick and so on, and then they'll go from there to the bed to have their blood withdrawn, and then that's bagged, if you will, and this is done in what they call units or pints, and they are typically, the unit equates to 2 pints. And so that is then taken to the lab, which is in the Baltimore region, and then it is tested. And specifically for sickle cell, for example, when the donor is actually at the site having their blood withdrawn, prior to that, one of the nurses will ask, whether they want to or not, have it tagged. And I say tagged, that's what they call a blue tag program. And if the patient agrees to that, then that particular unit or units of blood will be, if you will, specifically, I call moved up the ranks to test for the matching component to patients who are in need. And first thing person, in this neck of the woods, to Johns Hopkins, they have a major donor center, in this case, donor center, but a sickle cell unit or sickle cell clinic center there. And a lot of times that is evaluated, if you will, and it is it goes along a trend where it goes to a particular patient who needs it. And so it's tagged that way if the donor agrees to or wants to do that. I'm not then the other. So what was the rest of the question? Forgive me. I believe that's one of the.
No,
things
you answered it. You answered the question. The question.
Matching
and so, will you be at the blood drive, Mr. Anderson?
I would love to, but I'm going to be away, and that's the part. That's the part I hate. I would rather. Seriously, I do a lot of weekend blood drives. I did one last Saturday, and early on I said to Dr. Tisdale, I'm not going to be here, and that was painful because I would prefer to be a part of, from the start to from the beginning to the end.
Well, maybe you can give them permission to give me your Amazon gift card so I can have it.
So, but I plan to be a part of the annual, or maybe even if you get to the point where you like to do a second one, I would look forward to being a part of that, the continued relationship.
So Jack and Jill
support.
and the Trailblazers and Mr. Anderson, I know that it's really important that we put the information in the box to let the people know where to go to register. It'll be April the 29th. Am I correct, ladies? Tell me, Ari and Aaliyah, when is this blood drive again?
I believe April 29th from 9 to 2:30. And it's the Boys and Girls Club the address is 413 Burke Street. It's the Boys and Girls Club.
Okay. So, and I'm going to put this website up here. I want everyone, I think that is their website, and that is where you go to register. So please, please, please register and spread the word, you guys. We need to make sure that we get that blood donated, especially in the African American community. And also want to make sure that I get my Amazon card. So I'm sorry. I'm gonna make sure I get there. I'm gonna take lots of iron just in case I'm so I don't know. Take lots of iron, get my Amazon card, and don't be nervous because I don't want to faint. So so make sure you get out there and support the cause. This is their second annual event, and I'm pretty sure you're gonna have a lot more to come. Now, ladies, this is your time to shine. Go ahead and tell them why it's so important to get out there. Tell us why.
Okay, so I will go first. Sickle cell anemia is a genetic blood disorder that appropriately affects African Americans. It causes mishap in red blood cells that can block the blood flow, leading to severe pain and organ damage. Funding for research and treatments is not enough. We need to donate blood to help those with SCA. We need to raise awareness in the Black community and prioritize assistance for those affected by this disease. Please come and support our second blood drive. You can save a life.
Right.
Thank you for that. So you got to donate, make people aware, and make it a priority. I like it. Go ahead, Aaliyah. What are you going to do?
So I've kind of said part of mine, but I'll just do
it again, girl.
So people of African descent should donate blood because the need for Black donors is critical. If you are Black, blood from Black donors reduces the risk of serious transfusion reactions. 90% of all people with sickle cell anemia are Black, and less than 3% of all donors are Black. If you are of an African descent, we need you. Donate blood, save a life.
That's right. Donate and save a life. That is your duty. So I want to thank you, ladies, Aria and Aaliyah. Thank you for coming out tonight and being on my show. Mr. Anderson, thank you for coming out tonight, being on the show. And we hope to see you next time. And Dr. Tisdale, it's always a pleasure for you to be on the show. Trailblazers, Jack and Jill of Western Maryland, Red Cross, keep doing great work in our community. And until next time, thank you.
Very welcome. Thank you. Thanks.